Isaiah Junkins. I'm the program manager for the Caregiver Counseling Program. And today I'm going to be presenting a webinar, and along with my right hand, Jatina Gibbons, she's going to spearhead a lot of part of this webinar. Again, thank you all for being a part of this, and good morning to everybody. So without further delay, we're going to go right into our webinar. So we are the Chicago Department of Family Support Services, and our department is comprised of eight different divisions. We are Children's Services, Youth Services, Domestic Violence, Veteran Services, Workforce Services, Homeless Services, Senior Services, and Human Service Delivery. Those 6 divisions compose our entire Department of Family Support Services. Our mission is clear and simple. Working with community partners, we connect Chicago residents and families to resources that build stability, support their well-being, and empower them to thrive. Our priorities is to deliver and support high-quality, innovative, and comprehensive services that empower clients to thrive. Collaborate with community partners, sister agencies, and public officials on programs and policies that improve Chicagoans' lives and advance systematic change. We also inform the public of resources available to them through DFSS and its community partners, as well as being stewards of DFSS resources responsibly and effectively. What is the Senior Service Division? Senior Service Division. We are the designated AAA, which is Area Agency on Aging for the City of Chicago. In their role, Senior Service Division advocates, we plan, we coordinate, and we fund services for older adults, especially those in the greatest social and economic need, living alone and those aged 85 and above. Together with our service providers, we provide vital services such as congregate dining programs, home delivered meals, and access to benefits. The RFP that you all are sitting on the webinar for is the Caregiver Counseling Support Services for Seniors. What's the overview of this program? The goal of the Title III-E Caregiver Counseling Support Program is to assist family caregivers with services, support, and practical assistance in managing and navigating the challenges of caregiving through information and resources that include individual and family counseling sessions, group therapy, and support groups, as well as gap filling. How are we going to measure this? We're going to performance evaluate it based on percentage of clients receiving adequate counseling and support services, and we're going to require agencies to report demographics and invoices on a monthly basis. And again, if you all have any questions, please type them in your dashboard and we'll answer them at the end of the webinar. Program description. What is the Counseling Support Program? It's to assist family caregivers with services, support, and practical assistance in managing and navigating the challenges of caregiving through information and resources that include individual and family counseling sessions with licensed therapists that provide mental health counseling on a wide range of issues such as grief, transition, and depression. What are the group therapy and support groups? They are facilitated by experienced staff where group members provide emotional support for each other and share resources. And the last component is gap filling, which covers costly items such as handicap rails, medical supplies not covered by Medicare that help support the needs of the older adult. Counseling referral process. So this is our process of referring clients into counseling and support services. Our primary resource of referrals is for services through the Department of Family Support Services. Our IRNA unit located at City Hall, you contact them by dialing 312-744-416, or you can email them at aging@cityofchicago.org. The selected respondent may take direct referrals or walk-ins on site. However, their referral must be forwarded to DFSS Senior Services before any services can commence. This allows DFSS to monitor the number of referrals requested and follow-up services provided to the client. Walk-in participants for caregiver support groups, therapy participants do not need pre-referrals from DFSS. The selected respondent must conduct ongoing outreach activities to ensure participation of eligible individuals in the program. Such efforts may include, but are not limited to, public presentations, brochures, flyers, and other methods to reach a broad cross-section of family and formal caregivers throughout the city. Once this referral is made by the selected respondent, The selected respondent is responsible for contacting that client and determining the level of services needed to include the following. Determine if the caregiver counseling and support services are appropriate for that client according to the guidelines set forth in this RFP. Educate the caregiver on public and private programs and services available to both the senior and informal caregiver. And the last one is to make referrals when appropriate for other programs and services such as care coordination, including community care programs, home delivered meals, legal assistance, as well as services needed beyond DFSS to meet the biophysical needs of the client.
Counseling and support services key components. Individual and family counseling services. Counseling is defined as short-term, direct interaction between a trained counselor or intern, mentor, or peer closely supervised by a licensed counselor and an individual, family, or group to provide purposeful, therapeutic engagement to assist the family/informal caregivers in making decisions and solving problems relating to their roles as such. Therapeutic issues can include, but are not limited to, life/role transitions, interpersonal relationships around the caregiving role, dealing with anxiety and/or depression due to or exacerbated by the caregiving role, education and acceptance of resources to assist the family/informal caregiver and care recipient. DFSS approved modalities include individual therapy, family mediation, support group, other methods such as caregiving mentors, peer counseling, and psychoeducational or skill building groups. Individual/family sessions can take place at the selected respondent's office, in the family informal caregiver's home, or other places convenient to the caregiver, or over the phone. The decision should be made by caregivers and counselors based on the needs and circumstances of the family/informal caregiver situation. Group counseling and support services key components continue. Group therapy and support groups provide a minimum of 3 in-person support group sessions each month throughout the city at either a DFS regional or satellite center. The purpose of the support group is to provide a safe environment where caregivers can mutually support one another by sharing their thoughts, ideas, concerns, questions, and coping strategies in a non-judgmental and caring atmosphere. The locations of where the support groups will be held may be determined in collaboration with the DFS program manager. Topics may include, but are not limited to, family communication issues, financial issues, fitness and nutrition, home care, illnesses and conditions, end-of-life planning, senior safety and social life and activities. In-person support groups must be led in the language that will meet the cultural needs of the community. Responsible for coordinating, scheduling, and facilitating the support group discussions, including conducting outreach to recruit participation, scheduling of guest speakers where appropriate, and distributing information or handouts.
All right, we're going to take a pause here and take a brief moment, and then we're going to answer some of these questions that we have. What is the age group that will qualify for the caregiver support services? So there is no specific age group. As long as that person is a primary caregiver, they are eligible for the counseling and support group. And again, this is a caregiver program. So caregivers can range and there's no age range. There's no cap or there's no minimum number age, as long as they are a primary caregiver for someone. Do those who support licensed therapists have to be certified in counseling or may be degree personnel with experience? So yes, the therapist themselves has to be a licensed therapist, but the support team does not have to be a licensed therapist. They can be someone degree or have been trained in there, but the actual therapist leading the group has to be a licensed therapist. All righty, so the next component is the gap filling services. Gap filling services funds may be provided to purchase a limited supply of goods and services which complement the care provided by the family informal caregivers. When all the other resources for such goods or services have been exhausted, then gap filling funds can be utilized for, but are not limited to, purchase of medical supplies, supplements and equipment not covered by Medicare, Medicaid, or other insurances. Bless you. Requests for prescription medications or durable medical equipment must receive physician verification. Requests for consumable medical supplies should receive physician verification whenever possible. You also may be using for the purchase of specialized clothing, furniture, glasses, aids, etc. Also the purchase of safety devices such as emergency response system, home modifications, assistive technologies, etc. Emergency transportation, medication, or other immediate needs not covered by Medicare, Medicaid, or other insurances. Now, what you cannot use gap filling for is cash assistance, travel expenses, including vacation or other leisure-related activities. Although we would love to send people on vacation, we just can't do that, not with these dollars. Mortgage, rental assistance, and/or automobile payments, sports and recreational events and activities, no Bears games, no Sox games, no Cubs games, etc. Co-payments or deductibles toward items and services covered under other programs or benefits, or legal assistance, respite, chore, and/or grandparents raising grandchildren services, because we also have grants under those separate programs, and they can apply for those separate programs outside of this counseling and support program. Is low vision services covered? Yes, they are covered. Thank you for that question. You all have some great questions again. Thank you all for your questions. How are we going to measure your performance on this contract, under this grant? 80% of the clients surveyed responding to the survey indicate that the caregiver counseling support services help to improve the situation for which they originally sought services for. 80% of the clients responding to the survey indicated they felt less overwhelmed as a caregiver. 80% of the clients surveyed indicated overall satisfaction with services provided. How are we going to monitor and recognize intermediate progress towards above performance goals? DFSS also intends to track outcome matrix that may include, but not limited to, the 100% of the client determined to be eligible to receive counseling and support services. Again, thank you all for your great questions. If you have them, again, type your question into your dashboard, and we'll answer them at the opportunity we have.
Strength of proposed program. This process is open to all entities, nonprofit, for-profit, faith-based, private and public, licensed agencies that demonstrate experience serving older adults, and specifically within the area of providing counseling and support services, able to provide services citywide, very important. The applicant demonstrates a clear understanding of the target population and their needs and challenges. The applicant clearly defines services to be provided directly or through partnerships with other agencies that are appropriate to addressing needs of and achieving desired outcomes for the target population. The applicant's proposed program is supported by a strong national or local evidence base and or aligns with best practices for the relevant field. The applicant has an effective approach to identifying and retaining program participants, including rules, regulations that reduce barriers to participation. Program performance, outcomes, and quality. The applicant demonstrates evidence of strong past performance against desired outcome goals and performance metrics and or other notable accomplishments in providing services to the target population. If no prior experience, the applicant provides a clear rationale for its ability to execute against this program and achieve desired outcomes. The applicant has the relevant staff, systems, and processes needed to collect key participant and performance data and evaluate and manage performance. The applicant has experience using data to inform/improve its services or practices.
So we're going to pause and take a couple of questions now. So the first question is, can senior buildings participate? Absolutely. We are open to all senior facilities, private entities. We're not closing anybody. We're trying to reach all seniors that are in need of counseling and services under this support. And there are seniors, grandparents raising their grandchildren. They are residing in senior buildings, CHA buildings. It doesn't matter. We're trying to find a client. There's no stipulation on where these clients live. We're just trying to reach the client. How many clients are we expected to service at any given time? So we haven't put a time frame. So let's say this. So this program, this contract was not funded last year. So statistically, I have no data to go on. However, we want to expend these funds under this program. So we are asking for an agency that can come in, that can put together a vital program that this community needs, and that we can service these clients. And if we can run out of funds for this program, then that demonstrates the need for us to add additional funding to this program. Is paratransit covered under gap filling services? No, actually, because paratransit, most clients should be able to get paratransit through the SDR, through the special service transportation. That should be covered. However, we can cover emergency transportation if need be, but now we can't do paratransportation on a daily basis. Does the senior citizen have a given age for the program? No, there's no age for the program. Again, it's the caregiver, and them qualifying for this program is the fact that they are a caregiver. Will this information be online? Yes, it will be available online.
Hi everyone, my name's Tom. I'm helping with running the webinar in PowerPoint. We're going to post this recording on the DFSS YouTube channel, so you'll all get a link to that recording, and the slides will also be available too. And they'll also be available on the DFSS's website for the RFP and the
A link is posted to the DFSS website.
Yeah. So just to help answer that question. There's a couple more questions, and then we'll get back to the PowerPoint.
So it says, to help us understand the scope of service required and related to the counseling aspect, is this a no decline in terms of referral? And does the provider have to serve caregivers throughout the city, entire city, and based on whenever the referrals come from? Is it in order to better understand what the organizational capacity? So yeah, it is a citywide program. So we are asking whatever agencies that we award this to be able to serve a citywide contract. The scope of service. So yeah, there's no decline. Well, we hope you don't decline a client that is in need of counseling services. But if there are some extenuating circumstances where you can no longer provide counseling for that client, then we need, as a department, we need to be aware of that, so we can understand why you are declining any services for this client. And maybe there's some other program that maybe they don't fit under the counseling program, but there may be another program that we can fit them into. So yeah, we're saying that initially we want you to take on the client, but if there's something that comes up in the process where that client shouldn't be serviced under this program, then we need to know that, so that we can try to find another program that this client would be better suited for. Again, what is the age group that qualify for caregiver? Again, it's no age group as long as the person is a caregiver. As a caregiver, they qualify for this program. I think that was all the questions. Applications are due on March 5th, 2019 at 12 noon. Again, that deadline to have the application into the system is March 5th, 2019 at 12 noon. A link to senior RFP registration and technical assistance. On the DFSS website page is a link to the training documents and frequently asked questions. For questions on registration, go to e-procurement support at cityofchicago.org, e-procurement technical assistance for delegate agencies, or call 312-744-0358. Training materials are available on the city's iSupplier website at this link here. Application tips: start early, register into iSupplier e-procurement as soon as possible if you are not an already registered vendor. Review RFP narratives and application questions closely. They'll look different this year, and we want you to be well prepared to respond. And carefully review the selection criteria, and then use spell check. Tips of working in e-procurement: there's a 4,000 character limit, which includes punctuation and spaces. You can submit your application and later amend it up until the due date of March 5th at 12 noon. Avoid the rush, possible mishaps by submitting early. Late applications will absolutely not be accepted. And to make use of e-procurement hotline for help at 312-744-0358.
So this is Julia Talbot. If we have to
do an addendum to the RFP, which sometimes happens. What we end up doing is you will have to accept the notification for the addendum. So what we'll do, so what will happen is you'll receive a notification, and then you go in and you'll be thrown to a page that has this acknowledgement required, and that you'll review the changes, which will explain how and why the RFP is being amended. And then you accept the changes, and that will carry forward whatever work you have done on the RFP or your application into the new an amended RFP. But addendums and amendments happen, and so I want you to have the opportunity. I don't want you to be startled if this happens. A lot of times, the only way that we can update a system, like if we want to upload additional information, or we need to change a form or something like that. This is the way that can happen. The other thing that we will do often is just notify everybody who started an application with us through the communication notification process on e-procurement.
So, question: once you start the application, can you go back and complete it?
Once you start an application, you can save it and you can go back and complete it. You can also submit it, and if you submit it prior to the deadline, you can go and pull that application back and update it as well. So, for instance, you thought that the application was complete, but then you realized you wanted, you had more than 4,000. You'd only used 2,000 characters in one of your answers, and you wanted to add something more. You can pull that application back, make your change, and then resubmit, and it will be all there for you.
So your question is, how many contracts will be issued on this RFP? We intend to issue one contract on this RFP for a citywide vendor. Next question: will there be resources for a recruiter and administrative coordinator? So the contract, the total budget is $116,200. And in that, you have to build in your administrative costs. All that is done in the budget document that you will find online. Next question is, how are program expenses paid or a reimbursement? So yeah, program expenses are paid on a reimbursement basis. On a monthly basis, you will invoice for your monthly expenditures. It is not, you will not get money up front. It is, again, it's a reimbursable grant. Yeah. So are there, those again, some great questions. Are there any other questions? So again, for program questions, you can contact me, Ed Junkins, ed.junkins@cityofchicago.org. My direct office number is 312-746-6867. Those are for program questions. For non-programmatic questions, Julia Tabor, who you just heard from, she can be reached at 312-743-1679. Her email is julia.talbot@cityofchicago.org. Can you say the total amount of the grant again? The total amount is $116,200. That's the same question. And we're going to take another brief pause to see if there are any other questions before we wrap up this webinar. Thank you. Yeah, again, that contract amount is the total grant amount is $116,200. Do the counselors need their clinical license or just be licensed? Yeah, they should be a licensed clinical therapist. Yes. I had trouble finding links for the application. Are they visible on the page that shows e-procurement registration, or where do I find them?
You should go to the e-procurement page, and you should be able to see the RFP. When you log in, you can get to the application from there. if you have questions, you should actually email or call the OBM grant e-procurement hotline at 312-744-0368.
So the next question is, what's the duration of the grant program? So it's an annual grant, and we are actually already into the fiscal year, so we are trying to get this secured and done so we can get a vendor up and running very quickly. But this grant is renewable for, I believe, if I'm not mistaken, it's renewable for 2 years. So again, it's an annual grant that'll be done with a possible 2-year renewal. Are there any other questions? Great question. Again, thank everybody for your questions and for being a part of this webinar. So again, we like to thank. Oh wait, what's the duration of this? We already did that question. So it started. So yeah, the fiscal year has already started. So yeah, we need to get a vendor in place very quickly for this program so that they can finish strong for the rest of the fiscal year. Give us 1 second. We're having a brief conversation here, so we're trying to make sure we get everybody's question answered as accurate as possible for you all. Hold on 1 minute, please. So again, this bid process is open to March 5th, and so we'll probably look to get somebody in place and contract started somewhere probably in the month of April, which means, what we are doing as an agency, what we are doing as a department is that we are taking referrals from clients that are calling into our INA information assistance line so that we already have these referrals in place in queue. So once the selected vendor is in place, we can shoot you all the referrals for clients that are that are on the quote unquote wait list for these services. So you'll have clients ready to go on day one. So that's our hope, April, to get this program off and running to finish strong in the last part of the fiscal year. Can staff be housed at a Chicago or suburban location that is closer to the far south side? So we are contracting with the agency. So long-term services are for the residents of the city of Chicago, where you house your staff at. For us, it doesn't matter, but your services have to be only for the residents of the city of Chicago. And if your agency has a Chicago office, suburban office, that's fine. But the services under this program are for residents of the city of Chicago. And they can't go out to your suburban office to be serviced. All your services or your office hours or office location has to be in the city of Chicago. Are there any other questions? Oh, since 116 is not a huge amount and requires a licensed therapist, there's not much wiggle room to hire other staff. Again, that's the grant amount for this year. And if this program proves that this funding amount is not adequate enough, then we'll look at subsequent raising the funding amount in subsequent years. But right now, we have to prove that this program can expend this $116,000. So that's what the budget is. So we ask for agency that can work within that budget, that can still service the clients, that can expend that budget. What does the fiscal year end? The fiscal year ends on September 30th. It runs October 1st to September 30th. Any other questions? Should the cost of the gap services be figured into the budget? Mm-hmm. So the gap service is, so the way it breaks down, so of the $116,200, $42,200 of that is for individual and family counseling, $25,000 is for group therapy and support groups, and $49,000 is for gap filling expenditures, which brings the total budget to $116,200. So those are the three components of that budget. So again, the $116,200, that's the total budget amount. But the three components that we discussed previously during the webinar, the individual family counseling, that component has $42,200. The group therapy and support group, that's $25,000, and then the gap filling is $49,000 for a total budget of $116,200. Please clarify again. The contract ends when? The fiscal year ends on September 30th. If contract start time is 1/1, it should end 12/31. So when exactly? So again, it's the fiscal year, and unfortunately we are behind in the fiscal year. But the fiscal year runs from October 1st to September 30th. So that's going to be the contract period. And again, I understand that we are already into January, but that's the contract period. So this fiscal year, the fiscal year runs October 1 to September 30 period. So when that's the length of the contract, and then again it'll be renewable for the next fiscal year. Are there any other questions? If there's no further questions, again, we thank you all that came in and sat in on the webinar. We look forward to seeing proposals from the many agencies out there that's doing this work in the community. Again, thank you, and you all have a great day.